Thank you very much, and welcome. It's an honor to share this time with you. Thanks to Inspire and the partnership of great friends at the Scleroderma Foundation and the Foundation for Sarcoidosis Research. You may want to have a pen and paper handy for a couple of written exercises. Writing helps to reinforce and process the experience. If you are replaying this webinar as a recording in a support group session, just go ahead and stop for a longer period of time to do the exercises and then share thoughts with each other afterward. I'm sorry that we don't have the capability of sharing with each other responses, but I think there might be opportunities to post and share some of your thoughts about these exercises on some of the websites, Inspire and the Foundation websites. So I work as a physician and a researcher caring for difficult, very difficult diseases, which often require the use of infused biologics, chemotherapy, immunosuppressants, and other complicated pumps, etc. I also work within our research community to figure out how best to test these medications in clinical trials, as well as maintaining several clinical trials on our site. So I'm saying this because the point is that I'm unwaveringly committed to the availability and appropriate use of these wondrously powerful medications. And the reason that I believe in these medications is because I've witnessed their ability to save lives and to transform devastating health situations. And as I continue to prescribe these medicines, I still marvel at and am humbled by the power of these medicines. But not contrary to this, I am also a researcher and a teacher of mindfulness and mindfulness-based health strategies as a means of optimally and happily living with extreme challenges. Not only do I believe in these, but they are an important part of my own living. And they're also very well evidenced in science. But there's so much to share about what we're going to talk about today, and we've been gifted this hour. So let's go ahead and begin this workshop session with a 3-minute exercise. So you'd be wise to turn your phone off so you can completely luxuriate and focus on what we're about to do. Find a comfortable seated position in a chair. Uncross your legs. Uncross your arms. Allow your eyes to soften to either closed or a softened blurred gaze, and allow your hands to just gently rest on your lower belly. If you find that hands on the belly is difficult, just allow your arms to rest closely by your side so that they have some gentle contact with your trunk. Now allow yourself to notice the changing sensations in your hands or the side of your arms as the body rises against them and then falls away. As the body rises with a gentle inflowing breath, and notice the changes in sensation with the gentle outflowing breath. Allow your mind to rest on the sensation in your hands and your arms. Don't worry if you're distracted. If you are, just allow your attention to find its way back once again to rest on the experience of the changing tactile sensation of your body's breath against your hands or your arms. Stay with each sensation as it changes in your hands or your arms as the belly rises against your hands and as it falls. Stay with the sensation for 3 more complete breath cycles. And when you've come to the 3rd breath cycle and its completion, allow your eyes to gently open and go ahead and pick up your pen and write down whatever comes to your mind, whether it's positive or negative about the experience you just had, whether it's full sentences or random words or pictures. We have a nice long 30 seconds, so write down whatever you like. And we can come back together as a group. The body of the talk today will explore disability and symptoms and chronic illness, provide seeds for you, the participants, to rapidly develop these skills, because that's what they are. These are skills that get stronger with each second that they're practiced. The science behind these skills we'll talk about, and their application across the breadth of one's life, and the use of these skills also to protect the 4 pillars of health. Mind, body, strength. So that's what we're focusing on. Mind, body, strength is wholly reliant on our ability to focus upon ourself and to recognize the value and the power in focusing on ourself. Because when we do such a thing, we're then able to really optimize our own well-being and therefore being able to be more available to others. And I imagine that everyone checking into this session's greatest concern is just that, being able to live and be available for others, especially the ones that we love. So therefore, your focus must be on you as the pilot of your health and well-being. If you're a caregiver without a chronic illness that's listening, or somebody else listening in, these skills also magnify your health and well-being. And these skills enhance all of our ability to communicate well with each other. A chronic illness is defined as one that persists. It could be silent, it could involve physical impairments like sight or impaired hearing, ability to walk, move our hands. It could bring with it intrusive sensations that keep us from being able to connect well with others, such as pain or nausea or halting symptoms that impede us physically and also create barriers with others, such as shortness of breath or coughing or even diarrhea. And with it, chronic illness often brings a host of strong emotions: anger, frustration, anxiety, depression, continual fear, and uncertainty, and influences the everyday normalcy of our lives as we're having to rearrange and configure our performance at work, our finances, our time we see as being consumed with doctor's appointments, organizing our medicines. And additionally, sometimes we find that we're struggling with our own sense of identity, how we see ourselves, and our concerns about how others see us in terms of independence and freedom. So all of what I'm going to talk about today is focused on allowing your attention to fall upon yourself and assess your needs at any given moment. And this requires a component of mindfulness and listening to oneself. And through this mindfulness, we develop a stronger and deeper acquaintanceship with our ability to focus and our ability to be in touch and be our best possible self at that given moment, which includes making good decisions, either in the heat of the moment or long-term ones. It allows us to remain both physically and mentally in a place where we can handle stress much better, and therefore perhaps maintain a life balance and handle our symptoms better physically as well as mentally. You could probably guess I am not very good with advancing slides. But so stress is life, and life is stress, meaning that stress is a natural part of every life. Life is comprised of many stresses, and there's always something challenging in life. There is no panacea that is our birthright, as we all know. But chronic and unnecessary stress, as first described by the Nobel Prize nominee Hans Selye in his groundbreaking work, leads to unhelpful physical and immunologic effects in living creatures. And so it really comes down to how we manage these stresses. And this is true on every level. So if we consider what we know about the body, and the body is in a constant state of achieving balance, it faces numerous and constant microclots and cancer cells every second, just as the natural course of the body's occurrences. But also, as a part of its natural occurrence, it has a balanced mechanism where it simply notices and pretty much seamlessly destroys or dissolves these difficulties. But when balance is lost, health can tip in the wrong direction. And so this is also true of the mind. In one day, the mind goes through many cycles of assault, injury, and then struggles against these and attempts to repair or stuff away, whether these are stresses that are inflicted externally or whether they're stresses inflicted from internally. If the mind is fit, it can manage these and allow these stresses to undergo a kind of natural conclusion to a natural and more healthy place. And today we are focusing on techniques that are scientifically shown to support the mind's desire for balance and health, and thus our physical health. Dr. Herbert Benson began his work at Harvard in the mid-60s, producing the well-known book, The Relaxation Response, in the 1970s, demonstrating the short and long-term responses to mindfulness on blood pressure, pulse, respiratory rate, and oxygen, as well as other body chemicals. And further, this work suggested that the way a person's brain worked changed for the better, actually changed for the better, for the happy better. And this resulted in providing the platform for the following 5 decades of NIH-funded research into psychological, psychomotor, behavioral, neurobiologic, and immunobiologic research that has given us a tomb of evidence today. So what is this mindfulness? And what was that monk doing in the Harvard photograph on the last slide. Very, very simple. It's a triad of number one, moment-to-moment, non-judgmental noticing of the shifting sensations in the body that's caused by the breath. And number two, when the mind strays, as it naturally will, gently inviting it back again to number three, rest once again on the body's sensations of the breath. So in practicing mindfulness, we deepen our acquaintanceship with our body sensation and the breath. And each second that we practice this, the deeper this acquaintanceship becomes, and the more immediately available it becomes to us in times of need, even when we don't even realize that it's there working for us. So let's just take a few seconds to explore this on our own, these concepts of body and breath. If you prefer, you can, again, place your hands on your belly like we did before or in your lap. But I would like to try for folks to move on to exploring other changes in sensation that come and go with the body's natural breath. We're going to take a few minutes just to listen to the breath's movement in our bodies. So again, comfortable seated position, arms uncrossed, legs uncrossed, eyes allowed to soften to close or to an unfocused gaze. And just notice the small changes that occur with the gentle breath as it flows in and rising, and the breath as it gently is flowing out and deflating. Let your attention stay with the breath cycle. Exploring the various changes in sensation that occur in your body as the breath moves in and gently moves out. These changes can be maybe a little bit of pressure against your belly muscles, or an expansion, a gentle stretch across your back, or maybe even a little bit of pressure on your bottom as you breathe in and it moves against the chair, and maybe less so as you breathe out. Maybe you find another area where its movement in and out becomes sort of like a massage. Or even you might discover the sensation of the breath tickling the tip of your nose or your nasal passages as the air moves in and then out. If you're not comfortable focusing on your breath sensations, perhaps you can maybe listen to your pulse with or without your fingers, or focus on some ambient sound. Let your mind rest on some ambient sound that you're paying attention to. But whatever you choose, this connection allows us to relax our focus onto ourselves and come back to our body. And this technique that we are strengthening right now is what is going to allow us to have more readily available the presence of our best self. Stay with one more cycle of the complete breath. And then gently allow your eyes to open. So I revised this slide again for you. If you remember this slide from the previous. Here's how I would really like folks to be able to think about it. Mindfulness, that is, in the mindfulness practice. It is, for me, the continual re-engagement with pleasure. The gentle, soothing pleasure of the breath sensation in the body, or any other anchor that you happen to choose. And another way of looking at this is the allowing of the tiny tensions of the body to soften against and into the waves of the gentle breath. Okay. So the essence and the great fun of these exercises is the curious and the kindness one has towards themselves with this playfulness with one's mind when it wanders. And it will wander, because that's what minds do. They wander, and that's where the fun of this actually is. So we engage in these exercises with the spirit of pleasure and the spirit of playfulness, both when we're listening to the breath and also when we're trying to call our minds back, like it's gone off like a happy puppy somewhere. That is also playful and pleasurable. And at every step, we're kind to ourselves. So we're going to do another 3 minutes. And again, because you're becoming experts at this now, whether you believe it or not, science and evidence says otherwise. You are becoming experts at this now. We've done it twice already, at least twice. We'll do another set of 3 minutes, comfortable seat, legs uncrossed, arms uncrossed, body soft but open and erect. Allow eyes to soften to closed or to an unfocused gaze. Allow yourself to notice the gentle tide of the breath in and the breath out. Now, allow your attention to fall on one particular sensation in your body of your choice, whether it was the stretch of your belly, the stretch of your back, the pressure in your bottom or thighs, or the air tickling your nose, whatever you choose. Allow your mind to stay with this sensation with each breath cycle. And like a massage, allowing your mind to rest on that chosen sensation and the continuum of changes that happen with that sensation. Remember, your mind is going to wander, and that's okay. Just invite it back to allow itself to focus. And allow yourself to observe one more full breath cycle. And allow your eyes to gently open. And go ahead and grab your pen again and take 30 seconds just to jot down some thoughts. Okay, so what's going on here? Many of us feel like our lives are too busy and fraught with competing time challenges to embark on meditation or be a meditator, quote unquote. But the goals of what we're here today are not to make anyone a meditator, not necessarily, that is, but rather to plant the seeds of skills that can be used and augmented however one feels that they'd like to and are able, and to be used on the spur of the moment. The ability of the attention muscle, as I call it, can happen with even a very small amount of daily practice. And beyond meditation itself, we're actually focusing on the impact of these exercises, which is the development of a life or survival skill that enables a healthy navigation through the tiny and the very large challenges of living with a chronic illness. And this is supported by indisputable evidence that even a small amount improves all aspects of cognitive skills and communication, as well as physical and mental health, thus enriching happiness despite hardship. And spending time for a brief period, even 5 to 7 minutes, will provide the strength necessary to have your best possible self available to you. So embarking in these practices, we stay who we are. If you eat hot dogs, you continue to eat hot dogs, I guess. And if you wear sandals, you continue to do that too. But your identity doesn't transform. Just how well you sit with yourself, how you manage your health, how we interact with others. But the scientific evidence generated through the NIH and other well-respected entities points to internal change and internal protection. The brain itself changes in structure with increased density of nerve paths and the gray matter in the right places where you'd want them to be increasing, and change of brain function, as repeatedly seen on studies in advanced nuclear and other imaging, and demonstrating that there's enhancement in memory, executive decision-making centers, learning, and emotional regulation. And it even works to impact our genetic material, the structure of our genetic material in a protective manner. So this is the mind-wandering study, not to be confused with the wandering walk study. The wandering walk study demonstrated a very nice brain benefit to wander walking. But this study is different, and this study looks at the type of task, pleasant or unpleasant, and whether the mind was wandering at that time and the level of happiness experienced by the study participant. Well, surprisingly, even an unpleasant task executed with mindfulness brought more happiness than a pleasant task with mind wandering. And folks were universally happier when fully engaged in that activity, no matter how unpleasant the task. So when the mind wanders, we think what happens is that the mind is wandering to a place that is unpleasant, that is anxiety causing. So if we're able to harness the mind and be mindful and engage in mindfulness, we're less likely to move to those unpleasant places. Even pleasant tasks are associated with unhappiness when the mind is wandering. So we know the great and positive impact of mindfulness from scientific studies in patients with various mental and physical illnesses and symptoms, as well as the impact on mental health and the quality of care given by medical teams. Mindfulness, for this reason, is being taught at top medical institutions, not only at Tulane, but also at Mayo Clinic, Harvard, Stanford, and Brown, for patients and for health professionals. This is just a little reminder for me to share with you that there are, in addition to the exercises that we've been doing, which are the seeds of mindfulness, there are other exercises, and we're going to talk about where you can find those if you want to continue this practice, or just keep doing what you're doing as you learned it here today. So these practices can be happily be done throughout a busy day, though, again, a small part of the day, a few minutes set aside, can exponentially increase the impact and the strengthening of this practice. But dotted throughout the day, and that is every day, are opportunities for better mind health and for opportunities to practice. If we look at this slide and the bullets, these are various approaches of exercises that I often share with medical students and patients to consider noticing the breath for 20 to 30 seconds each waking hour. And that could be in line at the supermarket or at the red light, or while you're sitting in your car waiting to exit the long line at from the parking garage at work. You can also use 3 purposeful breaths as a mean to restore or refresh yourself, or in situations that are frustrating or angering, like when people are just rude or being the victim of poor traffic ethics, and it leaves you in a better place than getting angry back, is what I find. And we're going to talk about the sleep wave soon, which you can practice that every night as you go to bed. And then finally, in this short list of other opportunities to practice, noticing the sensual beauty of everyday activities. And we're going to talk a little bit more about that later. Insight Timer. This is a great application for for dedicated mindfulness practice. So you can time yourself, log your practices if you wanted to. It's available free from all the app stores. It has guided meditations and further more intricate meditations that are guided if you're interested in those. Some specific to, for example, sleep, or being pregnant, or recovery, for example. And amazingly, that there are guided meditations and other entries by well-respected and legendary teachers such as Eckhart Tolle, Sharon Salzberg, Jack Kornfield, Thich Nhat Hanh, Pema Chodron. So it's really like a cornucopia, as it were. It also has these little gadgets for ambient sounds, natural sounds, as well as having a supportive community. And we're looking at using this platform to develop a group for chronic illness. So this is my little this is what you get back after meditating. So this is a screenshot that I just snapped after playing with the timer for 30 seconds. And this is my avatar here, where I'm pretending to be my rose friend from my garden. And here it tells me, it's so nice. It tells me that, oh, when you were meditating, 2,000 other people were meditating with you. It really is quite sweet. So now, given all this and that we've practiced, again, the focus is on us, and we're going to move into talking about the the 4 pillars of medicine: sleep, nutrition, exercise, and we're going to talk about the introduction of the 4th pillar. So, the components of choices that we have as humans and as people living with chronic illness throughout the day that are in direct regard to our health are the choices and the organization that applies to eating, to sleeping, and to moving. And also the 4th pillar, to enjoying beauty of environment and beauty of one's own mind. And these are all interconnected with each other. And each of these important elements, sleep, nutrition, and exercise, and it also seems that this 4th pillar, beauty, as it were, from current neuroimmunological studies, are related to inflammation and to physical health. So we know that inflammation is increased in poor sleep. Hormonal effects of inflammation influence the brain and body fatigue. We can reduce inflammation with healthy types of movement and sleep, and perhaps food choices. And we know that inflammation has a direct effect on our muscles and bones. So improving the quality of our sleep brings tremendous benefits, improves globally our quality of life, allows us to think and make good decisions during the day, and helps us to feel good inside of ourselves, decreases pain, improving the brain's pain threshold, helps to stave off anxiety and depression, and helps us to cope with anxiety and depression much better, and generally increases our happiness as scientifically measured. So an important component of how well we sleep is how well we organize and how well we manage our sleep, and this is known as sleep hygiene. And the American Academy of Sleep stands by sleep hygiene as one of the single most important elements to promote sleep induction and sleep maintenance. Trying to advance my slide, sorry. But I'll continue. There we go. So And sleep hygiene, that means paying attention to yourself. And when you do that, before you go to sleep, you increase the melatonin, which is important to sleep. And that is your special unwind time, that routine that lasts for about half an hour before going to sleep, that the brain recognizes as you're going through these motions. And then your brain starts to prepare your body and open yourself up to a deep restorative sleep. Other aspects of sleep hygiene include addressing medications, including fatigue that could be, and eating habits that could be potentially intruding upon your sleep, as well as establishing a healthy movement regimen that we'll talk about shortly. And very importantly, we try to get folks to recognize that technology, especially 60 minutes before bed, can really interfere with one's sleep. The blue light from the electronics actually causes a decrease in the hormone melatonin, which is necessary for sleep. So we try to get folks to avoid video gaming, texting, and blogging before sleep, and we try to get folks to turn off their phone alerts before sleep. And this, you can review this in your own time when you come back to this slide presentation. But this is some. These are some strategies to establish your pre-slumber sanctuary to assist and to help you move into better sleep. And one of those is a mindfulness exercise that we can just imagine here together with me that you are lying in your bed, and allow your hands to rest on your belly. Allow your eyes to soften. Allow your attention to rest on the gentle rise and fall of the belly as the tide of the breath washes in and then washes out. And sometimes we bring in imagery like a balmy night, or floating on your back, or lying on a raft near the sandy shore of a smooth, moonlit tropical lagoon. But it is an effective and wonderful sleep aid. So very briefly, nutrition is another essential element to mind-body strength and requires mindful listening to one's body and organization for health. Nutrition impacts the way the brain works in terms of thinking, alertness, mental health, as well as happiness, reducing fatigue, increasing energy, and it's essential for healthy muscle bone and for wound healing to fight infection. You are welcome to come back and look at this slide, which is comprised of, again, of strategies to increase nutrition. So essential to the mind-body strength modem is moving and keep reminding oneself that every little bit that one does is beautiful, and every little bit of movement that one does is helpful. Even the very action of standing up, even walking to the water fountain at work, for example, finding any reason to move is a helpful activity. But a regimen like taking medicine, a regimen of movement introduced into your daily routine of 15 or 20 minutes, maybe building up to half an hour over 5 days a week, is best. And we know this has great impact on the brain's ability to function and our ability to perform at work and our perception of pain. So we can say indisputably also that movement is medicine. Movement is medicine. When we move, our body produces chemicals and molecules that are similar to those in medicines that we human beings take for blood pressure, sugar, cholesterol, inflammation, joint pain, stiffness, and muscle ache. And to reduce pain, medications that we take to reduce anxiety and depression, and we sleep better. An essential concept of movement for health is that movement should be pleasurable. It should feel good. It should feel delicious in the muscles. It should feel nice across the skin as the body moves through space, like a massage or a caress of the skin. It connects with the pleasure of movement. And this is a very deep connection to healthy muscle growth. So healthy movement, when we move in a healthy way, protects us against injury and pain, because the pleasure sensation that I'm talking about causes a relaxation that reduces the unhelpful kind of muscle tension and allows the brain to innervate with a healthy intrinsic tone of the muscle. And this allows for better, safer mechanical alignment, so that when we move, the work intensity and the impact of the movement lies safely where it should, in the large belly of the muscle and not in the joints. So developing this pleasure principle, if you will, takes thought, takes mindfulness, and staying with the sensations of the breath. So, it takes practice to develop, and you may need to move a bit slower at first to consistently engage in it. But for health, it should be present in most intense workouts and in our workout trainings, and applied to even housework or walking to the car. It helps to magnify the pleasure in your life through mindfulness. And healthy movement is for everybody, especially people who are living with physical disabilities. Okay. So we have just a few minutes left to talk about what I consider the fourth pillar, which really isn't my idea. It's very well grounded in scientific evidence, and that is choosing and connecting with environmental beauty and beautiful, nourishing thoughts and intellectual stimulation that promote well-being and elevate our spirit and intellect and make us feel connected in a good way to humanity and nature. So these are internal and external places that impact our feelings and impact our health. So these are sensations that inspire a sense of spaciousness that we feel within ourselves and in our mind, and can carry out and can carry us out of the stress of induced sensations of small or diminished or feeling closed in or cornered that sometimes depression and stress creates. So having some portable images on hand prompts us to better living and to ease and happiness. And Blaise Pascal is someone who knew hardship on many levels in his time, and this has been echoed in numerous shared examples of great leaders and heroes of our times, just like Nelson Mandela, Desmond Tutu, the Dalai Lama, Aung San Suu Kyi, etc. And so I was going to have you, but we're running out of time, look at this image and place yourself here and ask yourself about what sensations came to you: sounds, smells, skin, sensations of your feet, the breeze. And then I was going to have you do the same for this one, experiencing temperature, smells, taste. And then I was going to have you look at this image as well and ask yourself about temperature, smells, and taste. And you can come back to this recording and do this as a support group or on your own. And so ultimately, this happiness and ease we bring upon us is not an escape so much as an opportunity to expand one's perception of life at the current time by calling upon remembered sensations that are associated with ease and happiness. And this is the integration of sensory signals coordinated by place cells, for which the Nobel Prize for Medicine was awarded in 2015. And these are stored in our memories. The place cells help us recreate these sensations in the here and now, and can be an anchor of peace and clarity in troubled times. As an example, I use my password is something that reminds me of something lovely and helps calm me. But it doesn't slow me down. It just makes me feel better. So, okay, so I was going to ask folks to take a minute to write down their memorable places of peace and sensations, and you can come back and do this if you so desire. And these were just a couple of studies early on, a couple of decades ago, that demonstrated, and you could look these up, that demonstrated the scientific impact of beauty on healing after surgery, and also in the hospital environment on everyone there, patients and healthcare workers. And I have some recommendations. And I would like to thank you for letting me chew on your ear. And now I'm going to hand it over to Ms. Chandler.
Thank you, Dr. Saketkoo. That was very relaxing and informative, and we really appreciate your time. If you're able to stay for a few extra minutes, we understand if people have to leave, but Dr. Saketkoo, are you available to answer a few questions?
Certainly.
Okay, our first question, we have a participant who has been taking melatonin to sleep and is concerned about the safety of doing that.
So that's a very good question. Melatonin is available pretty much at any retail shop these days. The standardization of the formulations of the pills that we buy, it's important that you bring them to your doctor and you have your doctor look at what you're taking, because some of these supplements are better formulated than others, and your primary care doctor or other physician may be able to help you figure this out. But generally speaking, melatonin is considered a very safe supplement. But again, it would be very wise to discuss the dosage and the timing of taking melatonin tablets or pills with your physician.
Thank you. And if anybody wants to submit any additional questions, I just want to remind you that you can do so through the control panel. We have someone challenging the consensus around the wandering mind being an unhappy one. They find great enjoyment and creativity in letting it go wherever Uber Control seems unhappy, and they did provide a reference, but just wondering if you have any thoughts on that.
Oh yeah, I would be interested to hear what was the reference. So this is related. The study is a well-published study, and it relates to the completion of a task. So when you're charged with the completion of a task, and whether your mind wanders during that task or not. It is not contesting the joy and the beauty of daydreaming or the wandering mind in the context of perhaps writing or doing artwork or taking a walk. Remember that I did bring up the other study that was done last year, which is a beautiful study on walking and wandering and how that increases one's quality of life and quality of quality of cognition and other brain-related skills. And so I think we're talking about, I just want to be clear that I think we're talking about two different things, and I 100% agree with the caller who put the question forward.
Great, thank you so much. Well, it looks like that that is it for our questions today. I just want to go ahead and thank you again, Dr. Saketkoo, and to the Scleroderma Foundation and the Foundation for Sarcoidosis Research for making this program happen. We will be sending the recording to everyone by the beginning of next week, so you can watch the recording, and we will also be happy if you want to continue the conversation on Inspire. You can join the Scleroderma community, the sarcoidosis community. We also have a pulmonary fibrosis community for those that are interested to continue this discussion. And you can send any questions or comments to us at partner@inspire.com. Thank you again. And that concludes today's program.